Well, good afternoon. I want to begin by acknowledging we're gathered here in the traditional territory of Treaty 6 and recognize the Métis people who share a very deep connection with this land. Joined here today by my colleague Janis Irwin, our critic on housing, who will provide some additional remarks at the end of our presser. Now, I'm here today because the clock has run out on the UCP's ultimatum to the Marda Loop Clinic in Calgary. A clinic that has been planning to charge Albertans for preferential access to health care through members-only medicine. Now, the deadline was reached today with no clear statement from the province, no public appearance from the health minister, no investigation launched by the premier. Albertans who are being asked to pony up to see their doctor are left wondering what's going on. The province claims the clinic has decided not to proceed with fees on August 1st, but that begs the question, is this a permanent end to charging fees for access? Will there be fees to see a doctor at this clinic at some other date? Well, we called the clinic today and we asked the question, and we were told they're undecided about implementing fees. So, two completely different stories. It almost sounds like we're playing Whose Line Is It Anyway with our healthcare, where everything's made up and the rules don't matter. After 4 years of the UCP government creating chaos in our healthcare system, of Albertans losing their family doctors and access to critical healthcare services in their communities, we don't need more. I'm here to say our healthcare matters. Albertans deserve certainty, some assurance that their government values their access to a doctor and other health services as much as they do. It's time to draw a line in the sand. It's time to stand up for the foundational principles of Medicare. We're aware of at least 14 clinics who are charging members fees to access insured services, something that Health Canada has declared is a violation of the Canada Health Act. Let's remember, under the Canada Health Act, provinces that allow private healthcare providers to charge patients for access to medically necessary services will have funding clawed back by the federal government. Indeed, just this past March, Alberta lost $13 million because some clinics here have been charging for access to diagnostic services like MRIs and CT scans. Indeed, that's apparently what happens at Calgary's Harrison Health, where according to their website, if you pay $5,200 for their premier plan, they say they can get you to the front of the line. The longer this goes on, the more funding Alberta stands to lose. And that is unacceptable. In Alberta, you should never have to pay to see your family doctor. The Alberta NDP believes public health care is something to be protected and improved, not sold off and privatized. Premier Smith has a long history of advocating for more for-profit health care. However, she claimed this week that she will not let that happen in Alberta, but it is happening. And this premier is apparently content to do nothing about it. Now, just over here in the legislature, her cabinet has the ability to investigate and ensure they are protecting Albertans from these kinds of fees. We're calling on them to do exactly that, to investigate every instance of members-only medicine and end the practice. And if they won't, the Alberta NDP will. This fall, we'll bring forward a private member's bill to explicitly prohibit membership fees that cover insured services at medical clinics. Because you should never need a debit card, a credit card, or a club card to access your health care. All you should need is your health care card. Now, the UCP created this problem by driving hundreds of doctors and health professionals out of practice and out of the province, leaving tens of thousands of Albertans with no access to primary care, the foundation of our healthcare system. Allowing the commodification of healthcare will only make things worse. We need to see a real plan to support family doctors to provide the care that Albertans need and deserve. It's time to focus on what matters to Albertans, attracting more doctors, restoring critical services, lowering wait times. Let's put an end to members-only medicine. Thank you. I'll now turn things over to Janis.
Thank you, David. It's an absolute honor to join you here on Treaty 6 territory. I wanted to respond to some of the statements made earlier today by Minister Jason Nixon. We're dealing with a major housing crisis across the country, and I share in the provincial government's disappointment in the federal government's inadequate funding for Alberta's applications for the newest stream of the Rapid Housing Initiative. I support the mayors of Edmonton and Calgary in their call for an increase in funding allocation to the Rapid Housing Initiative. In Edmonton alone, more than 3,000 people are unhoused, and the need for permanent supportive housing and for wraparound supports has never been more clear. However, for Jason Nixon and the UCP to minimize their role in addressing this crisis is highly irresponsible. We all know we need immediate action on the housing crisis, and that requires all orders of government to come to the table. But the UCP are happy to point fingers elsewhere for their own failures. Over the past 4 years, the UCP has made cuts to affordable housing, to rental assistance, and they've refused to meaningfully invest in critical areas like permanent supportive housing across this province. If Jason Nixon is looking to place blame on the lack of funding to ensure that Albertans have a roof over their heads, he needs to start with his own UCP government. Thank you, and we're very happy to take your questions now.
Thank you, Janis, and thank you, David. I'll now ask media who are joining us on the Zoom to press the raise hand function to join the question queue, or if you're joining us over the phones, to press *9 on your telephone keypad. Our first question goes to Janet French from the CBC. Go ahead, Janet.
I'm wondering what you think about rental assistance as an effective means of creating affordable housing. It seems like possibly the government is lumping in the amount of money they spend on rental assistance into their affordable housing spend, and I'm wondering if you think that that's a fair thing to include.
Yeah, thank you for asking about that. In fact, I was just looking at those numbers earlier. And so when the UCP claims that they've increased affordable housing, they're doing exactly that right now. They've lumped in rental assistance as new builds or newly regenerated units, and that's absolutely not new affordable housing. And so, right now I've taken on this role as housing critic. Right now I'm really trying to engage with as many stakeholders as I can to see what needs to be done, because it's clear, hearing from so many renters, they're struggling right now, and it's hard to find access to affordable, safe housing here in all parts of Alberta.
You follow up, Janet?
Just to follow up, what do you think would be is it just a matter of more money being poured into new construction or renovations? Like, what do you think would be a more effective means of investment by the province?
Yeah, I mean, certainly there is a need for new builds. I do think, and Rachel and our team has talked about the fact that we do need to look at rent itself and being open to maybe having some difficult conversations around how we want to address rent. We know that Alberta is one of the only jurisdictions across Canada that doesn't have some sort of rent control, rent cap in place. And so I think we're at a time where we need to be open to having these conversations. And like I said right now, Janet, I'm really in the sort of fact-finding mission and just trying to learn as much as I can about this file so that we can propose some robust policies as we head into the legislature this fall.
Thanks, Janet. Our next question will go to Michelle Bellefontaine from the CBC. I'll just also remind other folks to use the raise hand function to join the queue. Go ahead, Michelle.
Oh, hi. Sorry, I wasn't sure I was going to get in so quickly. A question for Janis. So following up on the rental cap thing, I mean, Minister Nixon will tell you that they're opposed to rental caps because they believe that this inhibits the creation of new housing in the market, and it'll actually backfire, make the problem worse than it already is. I mean, how do you respond to that?
Yeah, I mean, I'm not sure what data he points to on that. But again, the reality is right now, Michelle, I've heard from so many Albertans, particularly Calgarians and Edmontonians, who just aren't able to find access to affordable rental housing in their communities. And so it's clear we need to take action, and I'm willing, I've been clear since taking on this role that we need to collaborate, and we need all orders of government to come to the table. And so I'm willing to work with this minister. I'm willing to sit down with him and talk to him, and I'm willing to have him join me in engaging with a number of the stakeholder meetings that I've got coming up as well. So, Minister, if you'd like to join me, I'd be happy to have you there.
Follow-up, Michelle?
Yeah, I mean, I appreciate that, you want to collaborate, you want all the levels of government, but this does seem to be a political cudgel that, you guys are using against the UCP government is using against the federal government. I mean, it feels like the whole process has become very political, to score political points against somebody who, you perceive as your opposition. So how do we get past that? Because, we've heard from lots of sources that this is a crisis. And so it's a crisis. So how do we react in a crisis, and how can we take the politics out of it?
No, and that is completely fair, Michelle, and I agree. I don't want this to be a political football. Every single day in my riding of Edmonton Highlands Norwood, I engage with unhoused folks. We have not seen this many unhoused folks ever in the time that I've lived in the community. And so it's clear that this is going to require, not just a response on the housing file, but on mental health and addictions as well, and healthcare broadly too. And so absolutely, like I said, I want us to work together. I don't want to see another unhoused person die on the streets in the communities that I represent. And so you've got my commitment, and David's and Rachel's, that we are taking this crisis seriously, and that we want to work together with our municipal, provincial, and federal counterparts on this file for real action.
We'll go to the graciously patient Kat Krakowski from Alberta Today.
Hi. The Prime Minister has said this actually is not a federal responsibility at all. This is up to the province and municipality to do more. So when you say all levels of government need to work together, why do you think the federal government has a role here?
Why do I think the federal
government has a role? I mean, both you and the minister are in agreement that this CMHC funding was inadequate.
Yeah.
Why does the federal government need to do more?
Well, I mean, and the best example is the one right now with Rapid Housing Initiative, right? I mean, like I said, I support Mayors Sohi and Gondek in their response, because, what I've heard from our city council colleagues is there were some really exciting projects that were proposed for Alberta, and specifically for Edmonton and Calgary, under the Rapid Housing Initiative, including permanent supportive housing. Permanent supportive housing, which we know not only saves money, also saves lives. And there's data right here in my riding of Edmonton Highlands Norwood at Ambrose Place as an example that proves that. And so for the federal government to not step up and inadequately fund some of these life-changing projects in Edmonton and across Alberta is where the federal government does need to step up and take some responsibility.
Okay. And actually a question to David. So when you call for an investigation, last week I believe in the joint statement the Premier and the Minister said that in the past they've done audits when there's allegations of these member-type clinics. What do you want to see out of this investigation? Does it look like an audit? Does it look like what do you want to see in that investigation?
I would like to see the government get to the bottom of the question, is what are Albertans being charged for when they're paying membership fees at these clinics? We know that in BC, the BC government indeed did its own investigation and indeed went to court with some clinics who are following exactly the same model as some of these clinics here in Alberta. Those clinics, they came to a settlement. They agreed that there were issues with the method they were using, the membership fees that were being charged. Here in Alberta, we know, it's clear from these websites, that they are specifically, now they use careful language, try to skate around it, but what they are saying is, you pay us a membership fee, we will get you better healthcare service, better, faster access. In the case of what the Marda Loop Clinic was offering, specifically, you get access 4 days a week, anyone that doesn't pay gets one. So it's clear that, especially in a landscape here in Alberta, where this government has so badly undermined our public healthcare system, and especially access to primary care and family doctors, where they have left tens of thousands of Albertans with no access at all, that we cannot afford to leave a sliver of daylight for anyone to exploit to charge Albertans for access to the healthcare services they need and deserve. So I would like to see, whatever form they want to take, an investigation looking into specifically what fees are being charged, what services are being offered, and how that is proceeding, to ensure that it follows with the rules set out under the Canada Healthcare Act.
Thanks. We'll just do one more pass for questions on the line. You can press the raise hand function. Okay, we're going to go back to Catherine.
I'll be greedy. So when you mention a private member's bill, it's already not allowed. So what would the private member's bill do that you can't already do?
So what we have currently, with the recent letter that was put out from the Premier and the Health Minister, is they leave a giant loophole. The loophole that currently exists. And that is, as long as clinics say that the membership fee they are charging is only for the uninsured services that they offer and not for the insured services, even as they make promises that if you pay a membership fee with our clinic, we will make sure that you get faster access to a diagnostic scan. This kind of language. So we want to close that loophole. Just make it absolutely clear that clinics cannot charge membership fees for people to access any insured services. So right now that's left open and ambiguous, and the Premier and the Health Minister seem to like it that way. We don't. We want to make it abundantly clear that no Albertan should ever have to pay, either directly or indirectly, to access insured health services in the province of Alberta.
Okay. With that, we will conclude today's news conference. Thank you very much, everyone.